Good morning, and thank you for tuning into our webinar today featuring Dr. Al Niaimi and Dr. Zaldivar. My name is Walter Guevara. I'm the Latin American Sales Director for Candela Medical, and I'm really excited that you are all here this morning and that we were able to restart our webinar series that unfortunately stopped when COVID hit. I'm looking forward to this presentation, at the end of which I'll be saying a few things about the technology and some promotions that we have with our distributors, and that hopefully will help you to look at this technology. We're very excited. And with that, I want to introduce, to begin, Dr. Firas Al Niaimi. He has been a great friend to us and a great speaker for us, and I've learned a lot with him. And when I had questions that needed answering, he's been a great resource. So with that, I will introduce him and let him begin.
Thank you very much, Walter, for the kind introduction. And good morning, dear colleagues and friends in Latin America. I understand and I very much appreciate that it's very early in the morning. So thank you in advance for taking the time to listen to this. So the reason why I'm actually very excited to give this talk is that because many of you know me from the pulse dye laser talks and talking about the V-beam technology in particular, which is one technology that's very close to my heart. But what has become apparent for me traveling around the world and giving lectures and lasers is that the ND-YAG as a wavelength, as a laser, tends to be ignored and neglected. For some reason, it seems to be just unloved. And it's actually a shame, because it is not that hard to understand. And once you master it, and once you use the ND-YAG, you'll find that actually it does much more than what most colleagues think. So really, what I would like to do over the next 45 minutes is just give you a taste, give you an introduction, just try and enthuse you with regards to what the ND-YAG can do, and hopefully you'll be able to incorporate that into your clinical practice. So just a little background about me, because you might be wondering, if you are in Latin America, why will you be listening to an Englishman across the ocean? Well, first of all, I trained in London. I have done a lot of work and academic work, but most importantly, I'm a friend of your continent. I'm a friend of Latin America. And I can justify that by showing some images. I mean, look at, the warm reception I have. This is in Mexico, and that's me in the Mexican costume. But this is Panama, again, with some of the esteemed colleagues in Panama. And this is me in Argentina, and I would like to thank Tecnología for inviting me and for all their logistical support. I've also been to Brazil, and I would like to very much thank Alvaro and his team in Brazil for their kind hospitality. I've also been to beautiful Paraguay in South America, and of course, Uruguay. So, I have traveled a bit in your continent. I love your people, I love your culture, and I'm one of your friends. So with that, I'd like to start really talking about the ND-YAG. And I think the simple way to start is by just posing the question, what can the 1064 ND-YAG do for your practice? Now, if I will ask most colleagues this question, even here in London, I will get one simple, straightforward answer, and that is hair removal in skin types 5 and 6 and leg vessels. That's most likely the answer I will get, but this is just a fraction of the truth, literally a fraction of the truth, because you're going to be seeing then that the ND-YAG can actually do far more. So let's start. If we just focus on one device from Candela, which is the Gentle Max Pro. As you know, the Gentle Max Pro is a dual wavelength platform. It has the 755 alexandrite and it has the 1064 ND-YAG. Now, we all know that the alexandrite 755 is the gold standard for hair removal in lighter skin types, and also you can use that for benign pigmented lesions. But if you look at the ND-YAG parts, the 1064, not only can we use that for hair reduction and vascular treatment, but it has many other applications such as rejuvenation, diffuse redness, acne, and also onychomycosis, which there's an entire section presentation at this webinar which my colleague Dr. Zaldivar from Mexico will going to be presenting. So I will not be covering onychomycosis. And if we talk about the Gentle Max Pro, just to give you an idea about what it can do, if you just look at the spot sizes, and you can see that you have a wide range of spot sizes, and that's important because, for example, we have the very small spot size 1.5 millimeter, which you can use in the YAG, perfectly well suitable for facial vessels. So you don't need to worry, because this is the other concern, is people say, I am worried to use the YAG on the face. And yes, you might be worried using a 5 or a 7 millimeter spot, but for discrete small telangiectasias, using the 1.5 millimeter spot is absolutely perfect for that. There's also the 3 by 10 millimeter elliptical spot size that you can use for example, leg vessels. But if you're using it for hair removal, you can also use a very large spot size. The other important part is that you have different pulse durations, and you will see in my presentation why that is important, is that you can actually go to a very, very short pulse duration within the YAG, below 1 millisecond, which is the microsecond mode. And actually the microsecond in the YAG is the one mode that excites me and excites many other colleagues too. So that's just an introduction. The Gentle Max Pro has two wavelengths, the 755 and the 1064, but it's not just that, it has many different pulse durations, including the sub-millisecond, microsecond mode, and different spot sizes for 1064, including the 1.5 millimeter, which can be used safely for facial telangiectasias, as well as the 3 by 10 millimeter elliptical spot size. So what I would like to discuss, I would like to talk briefly about hair removal and where the 1064 long pulse and the YAG fits in. Vascular users, there are plenty of vascular users, but also for those of you who probably don't know, you can use the YAG in acne for rejuvenation, dilated pores. You can use that for scars, whether they are flat or hypertrophic, certainly for warts and verrucas. And as I said, my colleague from Mexico will going to be sharing his experience in onychomycosis. So why are we starting with hair removal? Because let's be honest and frank about it. Whether you're based in a hospital or whether you're based in private practice, it is still the growth when it comes to the laser market. It's still the #1 laser procedure. So worldwide, the #1 laser procedure is still laser hair removal. It's not laser resurfacing. It's not laser for vessels or rosacea. It is still laser hair removal. This is continuing to grow, and it will continue to grow. So anyone with any sense of business mind, if you are looking into the future and in investments, of course, hair removal remains a core component of that. Now, not necessarily if you're a doctor that you should be personally doing these treatments. And some countries, like here in the United Kingdom, for example, we tend to delegate these treatments. But nevertheless, it is important that we talk about laser hair removal because it's going to stay and it's going to grow. It's a growing market. Now, a simplistic way of looking at the division in terms of, okay, which wavelength in terms of laser hair removal will suit which skin type. This is a simplistic way, which most of us will agree with, that if you have a lighter skin type, well, you'll be using the 755 because it works very well. And if you're a darker skin type, to reduce complications, we'll use the YAG. But remember, we live in the real world, and the real world is globalization. The world is turning brown. There is immigration. If you think, for example, that here in London, we're dealing with skin types 1 and 2, that's actually a fraction of my population. The vast majority of my patients are all the way from skin type 4 and 6. So it is very diverse, and in many countries, there is movement. But also people are traveling, and people are tanning, and we are getting summers. So even if you are a skin type 2 with a tan, now you will see that you can get some problems with the 755. So why is it important to incorporate 1064? Because it will going to give you some added advantages, as you will see. And if we look at the literature and if we look at the evidence in terms of hair removal, we know that these wavelengths work. We know that the 755 and the 1064 and the IPLs, they do work. But what is consistent from all the evidence is that the 1064 is the most suitable and the best one in the darker skin types because it has the highest level of safety. So I know that there are other wavelengths in between that claim to work very well for the higher skin types. but nowhere near as good as the 1064. But let's remember one thing. We are not just talking about 1064 for hair removal and darker skin types. We are also talking about 1064 in other uses as well. So it makes just a better business proposal to go for the 1064 rather than, for example, just a diode with limited applications. Now, I hope you can see the clinical images, but what you see is something that we used to encounter every time as we approach the end of spring and the summer months. We have these women who will go on holiday. They are skin types, 2 or 3. Normally, we would treat them with the long pulse alexandrite, fine. They get a tan, and boom, you get these complications. And that's because tanned skin absorbs the 755 very avidly, very strongly, and we start to get these complications. So the 1064 is very safe and can be used in these scenarios. And this has changed our practice because now, and this is another example. So women will go on holiday, they will wear skirts, they will get a little bit of tanning. We treat them with the 755. They used to be treated well, and boom, they get these complications. So what will be safer is to use the 1064. And I have published on this in terms of complications of lasers, that even the lighter skin types, when they have increased tanning, they can be susceptible to laser burns and complications using the 755 because it's very strongly absorbed by melanin. So how did this change our practice? By simply having the 1064 and the YAG, we can now treat all year round without the summer break, and we can also treat tanned patients. Now, do not underestimate the importance of this, because especially, so I'm based in EMEA in Europe, and I obviously do workshops in many European countries. And what happens, unfortunately, in some southern European Mediterranean countries is that many of them say, well, during the summer months, we simply don't treat. The clinic is closed, or they don't offer any laser hair removal because everyone is tanned, and everyone, if they're using the 755 alexandrites, most people will get reactions. So they will either undertreat and use very low fluencies and get unhappy customers, or simply do not treat. Now, what most colleagues don't understand or don't appreciate is that you can actually treat tan skin patients using the 1064 Nd:YAG. So we do a test patch. We see them after 48 hours. But with the Nd:YAG, the behavior of the skin is very different from the 755. So now we treat all year round. And because this is the question that is often asked to me, do you treat in the summer? Yes, we do treat. Why do we treat in the summer? Even the skin type 2 and 3? We treat them in the summer because we have the Nd:YAG. So even an English lady who's a skin type 2, when she comes back from the Canary Islands and she's having a tan, now, if you think you're just going to wait 4 to 6 weeks for that tan to just fade and then treat it again with a 755, that is a very naive approach. And I can tell you that we have had laser burns even 2 to 3 months after they've had a tan. And that is because some people can just hold on to the tan for a bit longer. So in that case, what's very easy is we test patch them with the 1064, and we continue treatment with the 1064. And as we approach the end of the summer months, or the tan fades, we then move over to the 755. Because we have one platform that has both wavelengths, we can continue to treat the patient. And it's absolutely fine, for the same patient to be treated on the 755, but because they have a tan and it's in the summer months, you switch them over to the 1064, and then after a few sessions, you go back to the 755. That is not a problem. It's just a different protocol. And we just need to guide the staff, but this is a key advantage, is that we can treat during the summer months, we can treat darker skin types, but more importantly, we can also treat the tanned, lighter skin types who could potentially have a problem with the 755. But that's not the whole story, okay? There is also growing interest in the use of laser hair removal devices for medical conditions. And this is a very nice article in the Journal of Cutaneous and Aesthetic Surgery that was published recently about the unconventional uses of laser hair removal. So that is using a laser for hair removal, but not with the intention of hair removal, but with the intention of an improvement in a medical condition. And these are some of the conditions where there is clear published literature and evidence regarding its use: pilonidal sinus, hidradenitis suppurativa, pseudofolliculitis barbae, particularly common in these skin type 6 patients. And these pseudofolliculitis barbae, where they have these ingrown hairs, especially in the beard area, sometimes it can even give them keloid scars. Treating them with the long pulse and the YAG can give a huge relief and improvement also in their quality of life. So if we look at pilonidal sinus, and this is something now where the general surgeons, the colorectal surgeons and the general surgeons are very well aware of this. And I get personally many referrals from the general surgeons. They will do a pilonidal sinus surgery. They will refer the patient to me for laser hair removal to decrease the recurrence rate. Those of you who are familiar with pilonidal sinus understand that it has a high recurrence rate post-surgery. But when you post-surgery treat them with the long pulse and the YAG, you reduce the risk of recurrence. So particularly if you are in a setting or in a hospital where there are surgeons working, you could collaborate with them. And this is one article that looked particularly at the evidence, and the evidence is there with the 1064 stronger than the long pulse alexandrite. And the same applies to hidradenitis suppurativa, a horrible disease where we get these boils in the armpits and in the groin. And yes, we do have tablets, and we even have biological injections. But these tablets, as well as the biological injections, can safely be combined with laser hair removal. So the intention here is not to use just the laser to reduce the hair growth, but when we use the laser hair removal, we also improve on the condition of hidradenitis suppurativa, because both pilonidal sinus and hidradenitis suppurativa relates to the hair follicle. That's where the main problem is. It arises from the hair follicle, and therefore treating the hair follicle with the long pulse and the YAG helps too. And again, just like with pilonidal sinus, for hidradenitis suppurativa, most of the evidence was with the long pulse and the YAG. So we understand that for some of these conditions affecting the follicular unit, pseudofolliculitis barbae, hidradenitis suppurativa, pilonidal sinus, the long pulse and the YAG seems to be better than the alexandrite. So if we just wrap it up in terms of laser hair removal and the Nd:YAG, what are the advantages of Nd:YAG? First of all, you can treat all skin types. There is no way, and there is no clinic in London that does hair removal that will just have a 755. You will not have any business, okay? I mean, 60% of the Londoners are from ethnic minorities, higher skin types and different skin types. And then you have all these interracial marriages. And even if someone is a skin type 3, they sometimes behave differently and behave almost like a skin type 4 when it comes to laser hair removal. So you're going to have a wavelength that will potentially be able to treat all the higher skin types and the darker skin types. You can also treat all year round. So there is no discussion of, do you treat in the summer? Do you not treat in the summer? What do you do? Fine. As summer approaches, we move them over to the Nd:YAG. We have a protocol in place. And then once summer is over, then we revert them back to the 755. This is for the lighter skin types. We can treat tan skin, so there is no problem with that. And this is important because many women are so careful about their schedule. They do not want to have longer gaps. They want to have the every 6 weeks or the every 8 weeks treatment. And if we can offer that to them, even if they have tan skin, using the Nd:YAG, that will be an added advantage. And also remember, there is better evidence for medical conditions associated with hair removal. Okay, so that's for laser hair removal. But now I would like to spend some time talking about some of the other things that we could do with the long pulse and the YAG beyond just hair removal in the darker skin types and in the tanned patients. And why is that? And that is because the 1064 is the only wavelength that is absorbed by all 3 main chromophores in the skin. So we use it in hair removal for targeting the melanin, but it is also absorbed by hemoglobin, and it's also absorbed by water, which is the main component of the dermis. So by using each of these chromophores, the 1064 can actually give us clinical results in different conditions. So let's look at some of the applications. Vascular, plenty. So anything venous, anything blue is going to be treated with the Nd:YAG. That is not just because it's deep, but venous blood is rich in deoxyhemoglobin, which absorbs very avidly the 1064. hypertrophic port wine stains, deep vessels in the legs. All of them can be treated with the Nd:YAG. Acne, which is not primarily a vascular condition, very nicely treated with the Nd:YAG. Warts, verrucae, diffuse redness or rosacea, tightening, rejuvenation, dilated pores, flat or hypertrophic scars, onychomycosis, and some other conditions too. But I just, given the time, would like to introduce you to some of the key things that we tend to do and we see a lot of. So if we are talking about using the long pulse Nd:YAG in vascular uses, the spot size matters, because if I'm treating facial vessels or leg vessels, then I would like to have either the small spot size, the 1.5 millimeter, which you can have on the GentleMax Pro, or the 3 by 10 millimeter elliptical spot size. If I'm treating venous malformations or lakes, then I'm going to use a slightly larger spot size. For diffuse redness, rosacea, I can use a larger spot size. So different spot sizes matters. So I get lots of requests for periorbital veins. You just numb the eye with some eye drops, put corneal protective shields, long pulse Nd:YAG, small spots, 30 milliseconds, beautiful. And this, you can see the clearance. This is pretty much a few minutes afterwards. Very nice results, very satisfying. Another example, periorbital vein. This is not something that you can treat with the alexandrite. This is not something that you can treat with a pulse dye laser. Okay, beautifully treated with the 1064 Nd:YAG. Another example, even sometimes women will pull down and say, I hate that vein there. That's fine. You can easily treat that with the long pulse Nd:YAG. Another example, no scarring. Dilated vessels, telangiectasias, all of them can be treated with the long pulse Nd:YAG. Same here. So again, this is an example where I say if you have the 1.5 millimeter spots, okay, which you have on the GentleMax Pro, you choose a 1.5 millimeter spot with the right pulse duration and the fluence, you can trace literally these individual vessels. Now, the chance and the risk of getting complications, such as atrophic scars with a 1.5 millimeter spot, is very, very low. If you're using a large spot size, yes, you can then get problems, but this is the advantage of having the very small, fine 1.5 millimeter spot that you can trace individual vessels. These vessels are deep, beautifully treated with the long pulse Nd:YAG, and then you can finish off with a larger spot size, the entire area. Venous lake, here, one single session, one single treatment with the long pulse Nd:YAG, choosing the correct spot size, choosing the correct pulse duration, you get that shrinkage, you get that cavitation color change, and in 3 weeks' time, it will disappear with no scarring. Other examples. Another example, you can see just even a small one, and you will be surprised. There are some women who will literally come and say, I just don't like this spot, and then you can just assure them that you can easily treat this. Another one. This is another venous lake that you can easily, clearly treat with a long pulse Nd:YAG. Now, let me tell you one thing. Once you know what you can treat with the Nd:YAG and you get the skill and the confidence, you will suddenly see in the practice things that you before did not used to see. So suddenly you will see the venous lakes, suddenly you will see the periorbital veins, suddenly you will see the leg vessels, because before, if you didn't have the Nd:YAG or didn't have the skill to use them, you will just overlook them or not even try and engage with the patients about it. But once you get that skill, suddenly you will see that you're coming across all these conditions to treat. Spider angioma, you can easily treat with a long pulse Nd:YAG too. Leg vessels, leg telangiectasias, in a combination with sclerotherapy, but using different spot sizes, different pulse durations. So for the very fine vessels, you'll use a 10 millisecond or a 20 millisecond. For the very larger reticular veins, you'll use a longer pulse duration. So and this is why I say it's important that you have a system with a long pulse Nd:YAG that gives you different pulse durations, because sometimes on one leg, I'll be changing the pulse duration 5 or 6 times, depending on the size of the vessel, the diameter of the vessel. So generally speaking, if it's red, it's around 20 millisecond. Once it becomes a little bit blue-purple, I use the 30 millisecond. If it's green, it's 40 milliseconds to 60 milliseconds. The feeding vessel, 50 to 60 milliseconds. And this is roughly the range of fluents that you'll need to coagulate these vessels. And why is it that you will need a higher fluence when we're using when we're treating the finer, smaller vessels? And that is because of physics. We all learn from physics, this is Bernoulli theory, that when you have a narrowing, you get a higher velocity, so the speed increases. So when you basically, if you go from a blue vessel, a blue vein, into a small red vessel, because the diameter is narrow, the flow of blood is much higher, is much faster. And with a faster flow means you lose the heat quicker. So you will need to generate a lot of heat very quickly. So the pulse duration needs to be short. Otherwise, if it's too long, you just have lost all that heat. And you need a high fluence because there is a low chromophore, because it's a red blood vessel, it's a small blood vessel with low chromophore. So you need a high fluence in a very short pulse duration to accumulate enough heat to get the coagulation and the destruction of the vessel wall. So this is why, because I get asked this question a lot, why do we use a much higher fluence for the smaller, finer vessels? And that is simply because the heat is washed away much faster compared to a blue or a green vein. And, you know, there's a lot of evidence that the 1064 is the best wavelength for leg vessels. This is one article looking at the difference between the 532 and the 1064. And even sometimes if you think the vessel looks very superficial, it's very red, I can treat easily with the pulse dye laser, that may be true in some cases, but in reality, when it comes to the depth, the 1064 gives us a much deeper, more uniform heating of the vessel, and therefore it is the preferred choice of wavelength for leg vessels. Now, this is where I get very excited. And, you know, sometimes there are certain companies that promote their Nd:YAG as one of their new Nd:YAG that does a lot of things. But if you look carefully, as we say in English, you know, the proof is in the pudding, you'll notice that it's an Nd:YAG with a microsecond domain. So it's simply going below 1 millisecond. So when you use an Nd:YAG below 1 millisecond, okay, let's say 300 microsecond or 500 microsecond, then we talk about the microsecond domain. So the pulse duration is very, very short. It's too short to overheat the epidermis, okay? Therefore, no cooling is required, but it is very much absorbed by water. Remember, the Nd:YAG is absorbed by melanin, hemoglobin, and water. So when we use a microsecond pulse duration of the Nd:YAG, it's too short to overheat the melanin, the epidermis, so we don't require cooling for that. But it is absorbed by tissue water, which is in the dermis. So in essence, what we're doing when we're using microsecond Nd:YAG is we are heating the dermis. We are generating heat. It's bulk heating. So any condition that requires heating of the dermis, you can use the microsecond Nd:YAG. And this is why we use it in acne, because we want the heat to stimulate the heat shock proteins, to get this bacterial killing, to get the sebocytes to regress. We want this heat of 60 to 65 degrees in the dermis to get that tightening effect, the rejuvenation effect. Heat matters in scars too. So the microsecond Nd:YAG has many, many applications. And I just want to show you, you know, very simplistically, that you can see this is how when you have the Gentle Max Pro, and when you have it on the YAG, you'll see green, you'll see that's the Gentle YAG. Just look there where I have just put an arrow, that's microsecond pulse. So it's very, very easy. When you go on the Gentle YAG, you choose the spot size, you then just dial in below 1 millisecond, and you can go as low as 0.25. So this is 250 microseconds. You can go 500 microseconds. So I always say that the Gentle Max Pro is not just two wavelengths. It's not just the 755 on the Nd:YAG. I say it's a 3-in-1. It's the 755. It's the long pulse Nd:YAG, which we'll use for hair removal, vascular, many conditions, but it's also the microsecond Nd:YAG. And it's astonishing how many colleagues actually didn't realize that they can go into the microsecond mode with the Gentle Max Pro Nd:YAG. So it's there for you, I can show you. So what are some of the conditions, again, that we can treat with the NDAG? Well, we can certainly treat diffuse redness, rosacea, and there are different protocols. And by the way, everything that I'm saying here in this presentation is backed up by evidence, backed up by literature. So none of this is personal opinion. All of this can be found in publications listed on Medline or PubMed. So it's actually very straightforward. You just need to spend some time going through all this literature, and even the settings are there. So everything is being published, and I'm just adding my experience to it. So for diffuse redness or rosacea, you can use the microsecond mode. So that's going sub-milliseconds, larger spot size, multiple passes, high frequency, or you can use a pulsed mode with cooling. If you want, for example, to choose the pulsed mode with cooling, there's even a publication in a very respected journal, the Journal of American Academy of Dermatology. This is using the gentle YAG. You can see the parameters that were used: 10 millimeter spot, 40 joule, 50 millisecond. I usually make it very simple and tell people it's 10, 50, 50. 10 millimeter spot, 50 millisecond, 50 joule. And then, of course, depending on the degree of inflammatory spot, the size of the individual spots, I will adjust the pulse duration or the fluids. But there is evidence using the gentle YAG, the 1064 from the gentle series in papulopustular rosacea. Now, another very nice study by Murad Alam from Chicago in the US. Here is a comparison between one of my favorite, which is the pulse dye laser on one side, versus microsecond NDAG. So that is high frequency, below 1 millisecond, multiple passes, heating, just like a Genesis. Okay, by the way, whatever the laser Genesis can do, we can exactly do the same with the gentle Max Pro, exactly the same, if not even more, because we have more control and choice of the microsecond pulse duration that we have. Both of them worked, but in darker skin type, the microsecond NDAG was safer. So you know when you have a skin type 4 or a skin type 5 with diffuse redness, and you're worried using an IPL, you may be worried using the pulse dye laser, or had a pulse dye laser and developed some post-inflammatory hyperpigmentation. Fantastic with the long pulse NDAG. You just put it on the microsecond mode, do the painting technique. They need few treatments, but you can get very nice results. So microsecond NDAG, microsecond NDAG, microsecond NDAG, single session, microsecond NDAG, single session, microsecond NDAG. Acne, again, just like with rosacea, you can use it either in the long pulse mode with cooling or with the microsecond. I don't want to get you confused. Once again, if you're using it in the microsecond mode, because of the very short pulse duration that is not overheating the epidermis, you don't need cooling. But whenever you're using the NDAG in a long pulse mode, you are going to overheat the epidermis, therefore you need cooling. So very simple. If it's in a long pulse mode, you need cooling. If it's in a microsecond mode, you don't need cooling. And I have published many years ago on the use of lasers in acne, including the NDAG. So this is nothing new. NDAG for acne. NDAG. NDAG. She's actually a Brazilian patient. And, this is important. If you think that you can put easily all patients on Accutane and give them antibiotics, well, good luck. Generation Z, they are very, very focused on the microbiome and the bowels. And I actually gave a presentation to Latin America about the microbiome and acne and the skin. We're facing with patients who simply want less systemic intervention and want, in addition to some of the topical treatments and the skincare treatments that they use, they want energy-based devices. And I can tell you one thing, if you don't do it, someone else is going to do it. This is what I learned. So, if I don't do it, I know that they're going to go somewhere else, and they're probably going to go somewhere who just has a cheap IPL, and we're just going to treat them. So I might better treat them because I know what I'm doing, and I can give them good results. Rejuvenation, again, it's all about dermal heating. If you can get that heat into the dermis, using the water as the chromophore, you get that inflammatory response, you get that stimulation of the collagen, the tightening, you're going to get good results. So how do we do it? Again, it's the microsecond mode, so a large spot size microsecond mode, multiple passes, and you generate that heat, and that can give you that nice tightening. You can use that for dilated pores, for example, or just in combination with HIFU. So this is a new thing. And I learned this also from my colleagues in Korea. So you use the HIFU, high intensity focused ultrasound, to get the heat deep into the SMAS layer. So you get that contraction, and then you finish it off with microsecond Nd:YAG on top. Okay, so it's a dual approach, and this is what we're starting to do. So HIFU first, followed by microsecond Nd:YAG, because what the HIFU will do is give you that tightening and lifting, but it doesn't necessarily always give you that improvement in the texture and the appearance of the skin. But that is what the microsecond Nd:YAG can add to the HIFU. So some examples, this is just all with the microsecond Nd:YAG. It will require a few sessions, but you can combine this, as I said, with high intensity focused ultrasound. And this technique, again, once again, everything that I'm saying is backed up by literature. There is evidence using the gentle YAG. So using the 1064 Nd:YAG from the gentle series. This is in Korea with higher skin types. So once again, they use the 8mm spot, 0.3 milliseconds. So that's microseconds. So that's 300 microseconds. In a painting mode, remember, if it's a microsecond, you don't need cooling. And that led to improvement in collagen. And the nice thing about the study is that they took biopsies as well after treatment, and they could see an improvement in the collagen. So it's also very safe to use in darker skin type because you're using a microsecond mode. So if you have a thermometer, basically what the idea is that when you're using the microsecond mode with multiple passes on the face, you're generating that heat. If you then use an external thermometer, a temperature of around 40, 42 degrees on the surface translates to a higher temperature deep in the dermis. And we know that the magical number is 60, 65 degrees, depending on what you want to do. If you want tightening and rejuvenation, you really want to get to 65 degrees, okay? Whereas if it's just diffuse redness and acne, you don't necessarily need to get that. To 60 or 55 degrees sometimes kickstarts the inflammatory response to give you that improvement. So for acne and diffuse redness, slightly less temperature on the surface, but for tightening and rejuvenation, higher temperature. Warts and verrucas actually can very nicely be treated with the Nd:YAG. I mean, it's just that there is a lot of evidence for the pulse dye laser, but equally there is lots of evidence for the Nd:YAG. This is just one article from Korea. Again, darker skin types, 369 cases, long pulse Nd:YAG in verruca. And I know my colleague and my friend in Mexico, Dr. Ricardo Galvan, he talks a lot about the long pulse Nd:YAG in verrucas as well, including at the ASLMS. He gave a talk 3 years ago. So you can use a small or a slightly larger spot size, depending on how thick and how large the verruca is. It's usually 20 to 25 milliseconds as a pulse duration, but very nice results. So again, this is one example, very difficult verruca with cryotherapy or salicylic acid. See the blackening, the darkening after the Nd:YAG, and nice clearance, no scarring. Another example, just I have a few more minutes, I'm nearly there. Scars, again, we're treating not just the vascular component, but we're treating the collagen component. Once again, this is where it gets confusing. Now, the best evidence, if you look at the literature and the evidence, the best evidence for using the Nd:YAG in scars is with the microsecond mode, So going below 1 millisecond. And there are two types. There is the contact mode with cooling, so that is using the high fluence. So for example, if you're using a 5 or a 6 millimeter spot around 60 joules, you're below the purpuric dose. So there is something called the MPD, the minimum purpuric dose for an Nd:YAG. So you can get purpura with an Nd:YAG, but that really is generally quite a high fluence. Sometimes you're likely to get some problems. But if you just go below that, so if you're using a 5 millimeter spot, something like a 60 joule is often below the purpuric dose, but it generates enough heat to have an effect on the vasculature and the collagen. And I will show you some of the reports that you can then go back and read about how the Nd:YAG affects the collagen fibers and scars. But it's always the sub-millisecond that has the best evidence. So if you're using it for hypertrophic or thick scars, you're using the high fluence with cooling, but still microsecond mode. But if it's just flat scars and you just want to improve on the erythema, then you do just the painting technique with no cooling. And that, again, can help. So, for example, this is one article published in Lasers and Surgery in Medicine almost a decade ago using the sub-millisecond, so microsecond Nd:YAG in dark skin type patients. Those of you who are familiar with keloids will know that the senior author here, Rei Ogawa from Japan, award-renowned professor in scars. And this article, you can get that free. It's online on PRS Open on the use of Nd:YAG in hypertrophic and keloid scars. So you can see here, when it's hypertrophic or keloid scars, you will use a high fluence with cooling in a contact mode, but it's still a short pulse duration in a microsecond mode. So just remember, Nd:YAG in scars, preferably with a microsecond mode. If it's flat, it's painting technique, and if it's thick, it's going to be the pulse mode with cooling. And even I published on this. This is my article in Lasers and Medical Sciences. This is 4 years ago on the whole evidence regarding the use of Nd:YAG, regarding the use of lasers in keloids and hypertrophic scars, including the Nd:YAG. Something that I recently did with our colleagues in Vietnam, a collaboration, is the combination of picotoning with microsecond Nd:YAG for some of the difficult melasmas. So those melasmas that are still not responding to the topical treatment and the picotoning, when you add in the microsecond Nd:YAG, you're targeting the dermis. Remember, we know that melasma has a problem with solar elastosis, with increased mast cells, with increased vascularity. We know this. This is why we give oral tranexamic acid. So therefore, you will see that there are many, many reports using the microsecond Nd:YAG in melasma. And that is because it's basically dermal rehabilitation. You're rehabilitating the dermis. You're improving on the solar elastosis through the microsecond Nd:YAG. You're improving on the quality of the dermis. You're also decreasing the vascularity. And if you combine that with the picotoning, you're getting good results. So we published this already. So some examples. Okay, so finally, look, I'm not a businessman. I am not really. And those of you who know me well will know that, you know, I just love to treat patients. And in fact, many patients I treat are pro bono, really. I just love my job and I'm very passionate about it. But throughout the years, I have also learned that talking to managers is very different from talking to colleagues. I can talk to you as doctors and you just understand where the Nd:YAG sits and how important certain wavelength is for certain medical conditions. But I can assure you, with all due respect, if I'm going to go to my manager and say this, you know, chances are I'll get nothing. I will not get the Nd:YAG because they don't necessarily, you know, understand our language. We have the advantage of seeing patients and knowing what's best for them. But really, managers look at it from a different way. So trying to convince a manager is going to be difficult. So over the years, I've learned to basically speak their language. Okay. So if you want, for example, to get an Nd:YAG in your clinic, you're not going to say, well, I need an Nd:YAG. You're going to have to say, well, look, I'll come up with a business plan. And this is what I did to get into one of the clinics, because I work across a number of clinics, but in one of the clinics, we wanted the Nd:YAG, and this is how I went about it. I basically just looked at what I was doing over the last 6 months, okay? So hard facts, pull data, what have I been seeing? And it's obvious, as a dermatologist, I'm seeing rosacea, I'm seeing acne, I'm seeing warts, I'm seeing dilated pores, I'm seeing rejuvenation, I'm seeing leg vessels, I'm seeing telangiectasias, of course. Okay, so I just made a very simple business proposal and said, look, if I just treat one acne patient, one rosacea patient, and one wart or rejuvenation or a leg vessel, and then just a hair removal a week. And, you know, we'll put it just at a relatively low cost for us, which is $300. So that's 4 cases a week at $300. That's $1,200 a week. So a month, that's almost $5,000. A year, that's almost $60,000. And that's just from one doctor. And then I convinced the manager to basically run some targeted marketing, Google ads. So for example, if you have an NDAG and you know that you can treat verrucas and you know that you can treat diffuse redness and acne, you can then just have a limited budget and do the right marketing through Google, get all these patients, and it will gonna grow. And that's how I managed to convince my managers. So, you know, talking to the managers is not talking about the evidence and here is the article. That's not going to work. But you give them a business proposal. You tell them, these are the things that I can treat with the NDAG, and this is what we can charge, and this is how I can get the return of investment. And it works. So finally, this is a very important slide, okay? I'm coming toward the end, and I've used my 45 minutes, and I'm very grateful for all of you staying in and listening to me. Maximize the benefits of the NDAG. The NDAG is not just a hair removal for skin types 5 and 6. No, it's a hair removal for skin types 5 and 6. It's a safe hair removal in tanned skin, even if they're skin type 2 and 3. It's safe to use in the summer, and it also has benefits for those medical reasons, such as pilonidal sinus or hidradenitis suppurativa. The NDAG can actually do about 70 to 80% of what the pulse dye laser can do if you know how to use it, okay? So it is a fantastic wavelength that's often unloved and misunderstood, and a lot of vascular conditions can nicely be treated with the NDAG. It also has some non-vascular uses like acne, warts, scars, melasma. And remember the popularity and importance of microsecond NDAG. So with that, I would like to thank you all. This is my email. These are my details. If you want to ask me any questions, I'll be more than happy to answer. And I'll hand over to my colleague from Dr. Zaldivar from Mexico, who will going to be talking about onychomycosis.
Hola, ¿qué tal? Buenos días. ¿Cómo están? Soy el doctor Federico Zaldívar. Estoy en Monterrey, México. Ahorita les voy a compartir mi experiencia con algunos casos de onychomicosis y bueno, vamos a comenzar la presentación. Perfecto. Bueno, les voy a presentar la técnica que utilizamos aquí en la clínica. Les voy a presentar también algunos casos clínicos, algunas generalidades. Y bueno, pues vamos a comenzar con algunas generalidades. Digo, no, el objetivo de la charla no es darles una clase de onychomicosis, sino más bien cómo lo trabajamos con el láser. Bueno, pues ya sabemos que el 70% de los casos son causados principalmente por dermatofitos, principalmente el Trichophyton rubrum. Sabemos que nos afecta aproximadamente del 2 al 13% de la población occidental, y que esta va aumentando con la edad, con el tabaquismo, la diabetes, trauma mundial, inclusive con la inmunodepresión. Y bueno, como ya sabemos y está publicado, el tratamiento oral pues sigue siendo el gold estándar, pero pues bueno, tenemos esta opción de tratamiento con láser para pacientes que no son candidatos al tratamiento vía oral o que no desean tomar algún tipo de medicamento. De los tipos de onychomicosis, bueno, pues tenemos la subunguial distal lateral, que es la más común. Tenemos subunguial proximal, la superficial, candidiásica y la fase final de la onychomicosis, que vendría siendo la onychomicosis distrófica total. Les voy a presentar ahorita algunos casos o algunos ejemplos de cada uno. Pues bueno, tenemos que la subunguial distal lateral es la más común de los 5 tipos, como comentábamos ahorita. Y esto pues comienza en el hiponiquio, en la zona distal, y esto produce hiperkeratosis del lecho, se va engrosando la placa, decoloración y termina principalmente con onicolisis. En la subunguial proximal, bueno, pues esta la tenemos que es la menos frecuente en pacientes sanos. Se ve principalmente en pacientes con alguna alteración de la inmunidad y se reportan una incidencia en 87% en pacientes con VIH. El agente más común en este tipo de casos es el Trichophyton rubrum. Y bueno, pues aparece con la misma frecuencia en manos y pies, va invadiendo el pliegue unguial proximal y ya posteriormente penetra la placa unguial y afecta toda la uña. En el caso de las onychomicosis superficiales, tenemos que el patógeno más frecuente viene siendo el Trichophyton mentagrophytes. Esta va invadiendo la placa, el lecho unguial, el hiponiquio, y se ve principalmente blanquecina la uña quebradiza y afecta principalmente pues toda la uña. En cuanto a las onicomicosis candidiásicas, bueno, tenemos que estas se dividen principalmente en 3 categorías. En una onicomicosis proximal que se asocia a paroniquia crónica, en una onicomicosis distal secundaria a candidiasis mucocutáneas crónicas y bueno, una onicolisis candidiásica. Y la fase final, que es como nos llegan aquí nosotros en la clínica, la mayoría de los casos, pues ya es la distrófica total, donde pues prácticamente la uña ya está totalmente destruida. Tenemos afección de toda la matriz unguial y pues aparecen masas queratóxicas friables. Esto puede ser causado por dermatofitos, mohos e inclusive cándida. El concepto del tratamiento de las onicomicosis con láser se comenzó desde los años 80. Alfelberg realizó publicaciones donde se probó con N de YAG de pulso largo, N de YAG de pulso corto, láser CO2. Y la diferente literatura reporta resultados mixtos, algunos tan bajos como del 27% de curación, y algunas otras publicaciones reportan resultados altos de un 80% de curación. El concepto del cual se tiene, por qué funciona el láser, es principalmente por el proceso, por la fototermólisis, que esto se debe a que la absorción de la luz del láser por el hongo se convierte en energía y en calor, y se tiene el concepto de que los hongos son sensibles a temperaturas mayores a 55 grados. Esa es la teoría de cuál es el principio de fungicida del láser al momento de nosotros realizar el tratamiento. Y pues bueno, ¿cuáles van a ser las ventajas del tratamiento de onicomicosis con láser? Principalmente, pues bueno, sin la necesidad de dar un tratamiento vía oral o en casos muy avanzados que no responden, disminuir el tiempo del tratamiento de vía oral en vez de que sea un tratamiento de 6, 12 meses. Ahorita les voy a presentar algunos casos donde nosotros en 3, 4 meses prácticamente limpiamos la uña en su mayoría. Es un tratamiento rápido. Nosotros aquí en la clínica las sesiones tardan aproximadamente 10, 15 minutos. Ok, no hay incapacidad, no hay recuperación, los pacientes salen caminando, la uña no se les cae, la uña no se les quema. Y pues bueno, otra ventaja pues es que con el láser no tenemos consumibles, así que básicamente pues no nos cuesta. Las desventajas, pues bueno, es principalmente el dolor o la sensación de calor, que ahorita vamos a platicar un poquito acerca de eso, que siente el paciente, y pues el costo principalmente pues de adquirir el equipo. ¿Cómo preparamos al paciente nosotros aquí en la clínica? Bueno, pues primero que nada el paciente debe de acudir sin esmalte o pintura en las uñas, ¿ok? En pacientes que usan talco, es muy importante que acudan con sus pies limpios, que no tengan talco, limpiamos inclusive la uña también, que no haya fibras ahí, residuos ahí del calcetín, si traen algún calcetín de algodón o algo. En personas que usan artículos de joyería, pues hay que retirarlos. En caso de que haya vello, hay que retirar el vello porque, pues como ya sabemos, el láser N de YAG también tiene afinidad para la melanina y no queremos hacer una depilación, lo que queremos es pues principalmente tratar la uña. No se recomienda ningún tipo de anestesia tópica ni ningún tipo de bloqueo porque es importante que el paciente nos esté dando retroalimentación sobre la sensación de calor precisamente para evitar complicaciones. Nosotros aquí en la clínica no hemos tenido hasta la fecha, en 4 años que tenemos realizando el tratamiento, no hemos tenido ni una sola complicación, pero sí es importante esto, que el paciente nos dé una retroalimentación